Brilliant. Hi. Good afternoon, colleagues. My name is Ash Crombie. For those that don't know me, I am the Assistant Director of Nursing, working with NHSIE for the Midlands region. But I'm currently actually on secondment out at Hereford and Worcestershire CCG 3 days a week until the end of March. So I'm now having to practice what I preach, and I'm now going to be supporting care homes across Hereford and Worcestershire. But since COVID commenced, really, I was asked to support some of the work with care homes, with PPE, IPC, and then moving forward, I still chair the Midlands Region Care Home Board, and it's a great privilege to be able to work with some of the care home managers, the UK HSA, which is the old Public Health England, and ADAS also. So we've actually done a huge amount of work with care homes as we move forward. And for a brief moment, albeit perhaps not at the moment, we finally got to stop talking about COVID and we started to address some of the bigger issues that was happening in care homes that care home managers felt that that would be worth us looking into. And really how this whole falls pathway commenced was care home managers saying to me that they felt that they were having to call 999 and they were waiting a long time for an ambulance to come out, and really they didn't necessarily need an ambulance for support. They actually just needed someone to be able to give them some advice on whether or not they could move a resident. And certainly from my quality role, we were having serious incidents coming through where a number of residents were lying for up to 16 hours at a time whilst waiting on an ambulance, which of course I'm sure we will all agree is just absolutely not acceptable. So this got me thinking about how we might be able to utilise our care homes to be able to support our residents when they fall, because actually not necessarily do you always require an ambulance. And that brings me into the background of this. So next slide, please. So approximately 8 to 10% of all of our 999 calls relate to falls. And really that is one of the most frequent diagnoses for those aged over 65, which does seem very young, but in truth that is a true reflection of what we see through. So I asked EMAS, the East Midlands Ambulance Service, and WMAHSN, based in the West Midlands, for just some data as to what exactly is the issue within our own region. So from April to August 21, I looked at the mean average calls from care homes, and there was about just over 4,000 of those per month, with only 2,400 of those being taken into hospital each month. And they weren't outliers. Certainly when I looked at the West Midlands Ambulance Service, they had slightly more, with 3,742 incidents from care homes, but only 2,400 of those residents being conveyed to hospital. Certainly here in Hereford and Worcestershire, we are seeing a significant number of residents that they're actually, when ambulance services go out, certainly in the last 12 months, about 1,000 of those 99 calls resulted in paramedics simply giving advice to the care homes. So there's a huge amount of potential there in terms of supporting those care homes with the decision making, but also feeling that, you know what, it's not for you to be making a decision on your own without any form of support. In August, just several months ago, we had the British Geriatric Society highlighting and publishing in one of their papers that residents that fall don't actually require to be taken to hospital, but a lot of the time can be managed within the care home by the care home staff. And that got me thinking about what we can do to try and improve this. At the moment, and my colleague Dan can probably give me further information if I've got this wrong, but pre-April 2021, the average length of time to wait on a Category 3, Category 4 call, 98% of those calls would be attended within 2 hours. Since April 2021, we're now expecting longer than 2 hours, with some calls like I mentioned, up to 16 hours. And during that time, those residents are lying on the ground, really potentially putting pressure on their tissue, causing damage, and also at risk of hypothermia. But also, it's exceptionally undignified way to be able to manage when you've had a fall. It also loses confidence for residents when they're mobilising in future. Next slide, please. So we already know that we can train and we can retrain, but actually we need something that's going to be accessible to all staff, even if it happens in the middle of the night or whether it happens when you've got new staff on duty. And it got me thinking about the iPads that we were all, with the majority of our care homes, were given during the COVID first wave. And a lot of the care home managers felt that those iPads were actually underutilised and they weren't really being used frequently. So it got me thinking about how we might be able to use those iPads to be able to use an app or some form of training to be able to help support the care homes. I came across some evidence that the Welsh Ambulance Service has successfully piloted an app called the iStumble app. It's a free app supported by the Mangor Falls lifting team. And basically, it was developed by paramedics to aid decision making relating to falls. And they found a significant amount of falls that were falls that took place. Care home managers were able to manage those in-house without having to require the support of an ambulance service. And that was really just, again, based on the care home managers advising us that they just require advice. And hopefully this iStumble app may be able to help with this. So at the moment, across our region, we've done a bit of a count. We've got 2,277 iPads in care homes across the Midlands region, and we're now trying to make use of this best investment. On the back of this, both East Midlands and WMAHSN have the capability of using video conferencing to undertake remote consultations. So this is something that we're also developing as part of our digital technology offer. And one other thing that I'm sure colleagues on the call will be aware of is that our urgent community response teams are trying to be able to start working, and as part of the 100-day challenge, we thought about how they might be able to support quicker contact into care homes. And at the moment, for those Category 3 and Category 4 calls in the West Midlands, there's about 500 of those calls taking place each day. Even if you've got the most effective 2-hour urgent community response teams in the world, they're still not going to make a massive dent into that demand. And therefore, whether or not we can utilise some of these remote consultations and the use of apps to try and support the impact that UCR teams can have. So I'm just going to pass you over to Dan, who's going to run through the pathway that we've developed. Please bear in mind that this pathway is not necessarily fixed in stone. Each locality and each system can develop it and add to it or take bits away as they see fit. The right hand of the pathway is not for negotiation, so to speak, but the left hand of the pathway is really up to each system to make as they wish. So I'll pass you over to Dan's capable hands.
Thanks, Ash. Afternoon, colleagues. Really lovely to be given the opportunity to speak to you about this important work, actually, and I hope we can work through how we can make things a little bit better for our residents that do have a fall and then a need for kind of medical aid at the end of the day as well. So this assessment tool that's on is just an example of something that's found within the app that's being rolled out that we're referring to, called iStumble. And the things down the left hand side of that page actually spelling out iStumble. So just things to think about when you or your staff, your colleagues are coming across a resident that may be on the floor, that maybe has had a fall that you've witnessed, or a slip or a trip, or in fact that you found not necessarily knowing how the resident has come to be in that position. So this is just a little reminder, a little mnemonic, if you like, for the things to look out for when you're approaching a resident on the floor. If we go to the next slide though, and I'll kind of work backwards if that's okay. Thank you very much. I've noticed a question saying, where can we get the app? I believe that's coming. I think Dan is going to be working us through what that's looking like shortly, but it's going to be on the iPad if it's not there already, depending on, I think there's a question coming up about availability of iPads and things like that. So Dan nicely teed up their question from Anita to get that bit across. So first of all, I know Ash has mentioned the background of how we've got to here. I work for NHS-EI in the region responsible for ambulance performance and improvement, and it's probably fair to say that, as alluded to, actually both our ambulance services are under significant pressure at the moment, and actually what I'd like to reassure you to start with is that part of this work is making sure that when you need an ambulance to respond to one of your residents in an emergency, for a life-threatening emergency, or something that has an urgent need, our ambulance services, whilst they are under significant pressure, are still responsive for the majority of the time. So there are times of the day and there are places across the region where actually our ambulance services do struggle to do that routinely, but actually for someone that's having a life-threatening emergency, your ambulance service is still there to support you and your residents if they need it. What this is about is maybe protecting that responsiveness as well, and making sure that the ambulances are available for those kind of higher acuity, really critical need. So this pathway has been developed to help us all think about what that need might be. And what we're asking you to do here is if you do find a resident on the floor, to kind of make a very quick judgment first of all as to whether your first step should be 999 or not. And that might be thinking about if the resident's awake and talking normally or not. And if they're not, absolutely go straight in for 999 and be guided by the call taker, the emergency call handler, that will help you through what your next steps might be. If that's not the case, so actually the resident is awake, they're talking normally, you know, they're familiar behaviour to what you might expect, then the left-hand side of the pathway is what we're going to go down. And using the NHS issued iPad that Ash has already mentioned, there's an app on it called iStumble. That's been developed by Mangar as a company, but more importantly endorsed by the English Ambulance Services and NHS Wales. So there's a little bit of kind of support there that it's something that's absolutely the right thing to do for this scenario. And it's really intuitive, actually. Dan's going to talk us through it a little bit, I think, in a second. But the boxes there, the green outcomes or the red outcomes, follow through the questions that the app is asking you to think about when you attend to a resident that has fallen or is on the floor. If the app picks up anything that's really critical or anything that might need an ambulance response, it's a red outcome, and then it will lead you to making that 999 call in the first place, and it will take you back over to the right-hand side of this pathway. If you get through the questions that it's asking you, every response is green or okay, then actually it's giving you the confidence to understand or to think about the fact that there's no need to call 999, and actually the resident can be made comfortable, can be lifted from the floor using the correct manual handling techniques and equipment. And then once they're comfortable, once they're safe, once they're off the floor, then there's the opportunity to just reassess for any kind of illness or injury, and then seek medical advice. And that could be from a range of options across the bottom that depends on what you've got available locally. So that might be reaching into 111, it might be going straight into a 2-hour community response, something like that. So it's really just making sure that we've considered the options when we're next to the resident, and this app will help us do that. Just if we do end up on the right hand side of the pathway because we've gone into 999, it's just worth kind of remembering that to make that as an effective a process as possible and really help the ambulance services to determine how quickly they need to get help out to you, it's really important to try and do that from beside the resident where you can. So using a mobile phone or using a phone that you can answer the call handler's questions from beside the resident. And actually, most importantly, I think the thing that I can stress the most here is that depending on which way the questioning is going, sometimes the ambulance service on the phone might tell you not to move the patient, but that's designed for a non-medically trained bystander in the street, if you like, that's come across someone that maybe has had an injury or something like that. Actually, from your professional environment, it's absolutely appropriate to make the resident comfortable and to make sure that if there is going to be a delay in getting help out to them for whatever reason, that they maintain that kind of comfort, the dignity, and all of those things that go with it. And I'm sure most people by now will know, but it may well be that at some point in the pathway of the kind of wait for the ambulance service, that a paramedic might call you back on the phone, may or may not use video consultation, and the outcome of that might be a route back into the original kind of urgent community response or falls team. Again, it depends what's happening locally. This is an idea for a region-wide approach, but different parts of the region are doing things ever so slightly differently. So the outcome could be one of two ways. So I think that's all I'm going to say. Hopefully that's teed Dan up as well for some bits that are coming your way. But thank you very much again for engaging in this process. Thank you for being here this afternoon, and thank you for helping keep our residents safe and comfortable going forwards.
Dan, just before you move on, everyone's called Dan, so apologies, Dan Hodgkiss, I mean, just letting colleagues know that your ICS leads have been given this pathway at the moment, and where we're up to from a development and implementation point of view is that on the left of the pathway, you'll see the boxes. What we have sent this out to each of the ICSs are going to make this personable and relevant to their local care homes based on the offer of support that they have. So Dan's touched on that during his presentation, but actually it may be that the pathway will look a little bit different for you, and the very bottom of it may say, if you can't move the resident and you need some help accessing equipment, dial a certain number, or it may be that contact the falls team who'll be able to give you advice further. So the pathway will look slightly different depending on where your care home is based, and that will be your local CCGs are just developing what your fall pathway will look like for your area. So they will be in touch in due course, and they will be offering training, but your pathway will be bespoke to where your care home is based. We're not dictating that there's one size fits all approach. It'll be very much based on what type of falls support is available locally.
Excellent, thank you both. I'm just conscious that we have got some questions, so at this point I'm going to go to some of the questions before we move on to the actual use of the app itself, and some might get addressed there, but I think there's some really pertinent questions that are coming through already. So I think the first was from Donna around whether the use of this pathway and iStumble will override existing falls pathways within care homes.
I think it will be dependent. So I would say is please don't crack on and try and use this pathway. Your CCG, speak to your local CCG, who will be able to give you some advice as to whether this is something that they're going to be taking up on. It might be that they've got a different falls pathway that they're wanting you to follow. So I would suggest, as whilst we've shared this, and I think the majority of the region are likely to follow this up, I think until you're contacted by your CCG and told that this is going to be rolled out in your care home, please continue with your local policies at the moment.
Excellent. And then the next one was from Jodie, and she was saying about difficulty obtaining help and support following resident falls, and hopefully this pathway will, where it is rolled out with your CCGs, help with some of that, so you will get the responses proactively, whereas we know at the minute, because of the pressures, and I'm sure Dan would concur, that that's not always there in a timely manner, but actually hopefully the pathway will help with this. So we know that those in the left hand side actually might not need that preventative support. They might need things afterwards around physio and frailty reviews, etc. But I think all of this, and the fact that we talked about deterioration earlier, it all links back to that wider pathway around deterioration. So it's really important that if you're using soft science tools, we're absolutely not advocating that you stop using those tools. If you're using frailty assessments and updating where somebody has recurrent falls, which is quite new, that you update their frailty status, we would absolutely support that you continue to do that. But hopefully this then links through as a pathway approach to all of your health and social care colleagues. So local authorities, CCGs, your GPs will become aware of this. So there is a whole set of webinars, and we'll be linking this through the ICS deterioration safety networks. So absolutely all of your agencies will be involved in knowing about this pathway and how it supports. I don't know if the two of you have got anything else further to add to that one.
No, I think it'll just be a case of watch this space. The other thing, Dan, just to mention, on the right of the pathway, Dan Barnwell did mention it, but we are encouraging East Midlands and West Midlands Ambulance Service to call you back using your iPad to do a virtual consultation, so they can see the resident, how they're lying, and you can talk through the conversation about what exactly is going on. Just based on that information, just to reassure colleagues that this has been approved at the highest level, and at no point will your image of your face or your conversation be recorded. It'll be your verbal, as you would do if you called 999, but there will be no imaging recording made of your consultation, so we're not in breach of any GDPR guidance.
Excellent, thank you. Naz, if we could have the next slide. I know there's a couple of slides here. I don't know, Ash, if you wanted to go through these. I think we're probably already addressing some of these, but
I think we've probably addressed them. I think the big thing will be is that the future of this, I've just been speaking to some of my own CCG colleagues, is that really this has got potential for CCGs and systems to make this as they wish. So, one of my colleagues today was just discussing whether or not this could be rolled out to those living with frailty in the community, and whether domiciliary care could be using this also. Because really what you don't want to do is, you've already got dom care, a huge amount of pressures on that resource. What we do not want is somebody to go out there, two carers go into someone's home, they've taken a bit of a fall on the ground, but they're then having to wait 8 hours eight or 9 hours with that individual until the ambulance comes, whenever actually they might be able to make a decision to follow a pathway. So really, this is not limited solely to care homes. We're talking about care homes at the moment, but perhaps this could be looking at families that look after elderly loved ones and have got access to digital technology, dom care providers, or those living in other settings also.
Excellent. So we're going to go through now about the actual iStumble app, and we'll take you through step by step. But before that, I just want to guide you a bit of a sense from you all about whether you've got that iPad and whether you're using them, and then whether you have got iStumble. And I can see that, Jamie, you've already put some great links in the chat about that you're already sharing the app with members of your care home associations, and that actually how to download it. If we just go to the Slido again, I can see some of you. Excellent. That's what we were hoping would happen. So from the scope that Ash and ourselves and others have done on this, we hoped that those iPads were available in each of the care homes that we've got. So that's really reassuring. So if we could have the next question, please. And the next one is more specifically about the actual app and whether you've got that already. And I guess there'll be a much more varied answer on this one. Interesting for the iPad, how it's being used. So video calls with families. Okay, excellent. I'll give it a couple of seconds or so for answers to come through on this. And I think for those that are already highlighting early on that video reviews with GPs is a really important one, because the response with the ambulance service will be exactly similar to what you're getting with the GP, so that you have that remote consultation in a timely manner that links to the fall. So then you'll know whether residents are able to be moved if you don't know that already. So this is excellent that you're already using them for remote consultations. Excellent. And then the last question is whether you're actually familiar and using iStumble already. So if we move on to that. And it's nice to see that some of you indicating that you are, a small number. So in the question and answer session, after I do the next few sets of slides, it will be really good, because we're going to open it up then for a bit of a discussion and Q&A around the falls pathway and the use of iStumble. If at that point those that have indicated yes could just, if you're feeling brave enough, put your camera on at that point and share how you're using it and how useful or not it is, that would be really helpful. Thanks for that. Now, so if we go back to the slides, so clearly I think Anita shared initially a really great question to start us off that looked at how we download this app. And given that you've all got the iPads, the team that have been working on this have been working with NHS DNX to look at whether this could be downloaded centrally onto your iPads, and that's been done. So what it's been linked to the apps in your control center and your self-serve. So all you have to do is search in your self-serve or your control center on the iPads for iStumble, and you should find the app there, and you just download it onto your iPads. Sign for Google, so it's there, and you can download it from the stores, but it should be already in your control center or your self-serve center. So we'll send some guidance after this session around the downloading of that and how you get it physically onto your iPads. But it should be relatively quite straightforward to download. We're given that assurance that it is. So if we could have the next slide, please, Naz, but we'll make sure that comes out. So when you do download, this is what you get as a first visual. So this is obviously taken off a phone. It will look slightly different on an iPad, obviously, much wider. But it gives you then that iStumble's fall guide, and that's what we're really recommending here. That falls assessment toolkit that Dan has shared. Those red flags or red outcomes, which you know, is clearly then the indicator to call 999, and we'll go through those. But it will ask you where there's a fall just to start going through. So if we could have the next slide, please, Naz. Next slide, that's it. So you've already seen this in an earlier slide, but I just wanted to go through some of those red outcomes for falls in more detail. So first, clearly, is intense pain. If we can see that resident is in pain, and that might link to a later one of the iStumble acronyms, is it could allude to a fracture, you know. So we need to be really cautious where there is that intense pain, and then call, you know, as a red outcome. And it will, the app takes you through the assessment of each of these. So it will ask you questions specific to each of these subheadings. And obviously, if you answer no to them all, then clearly the resident is okay to be moved if no red flags are showing. Next is that suspected collapse. You know, was it a collapse, a trip, etc.? Is there sudden nausea and dizziness as a result of that? You know, are they fainting episodes or are they falls episodes? And we need to be clear about which they are. Equally, it could be linked to another deterioration, and that's the key here. It could be linked to a stroke, for example. So the app will take you through a fast service where if there's slurred speech and different things like that nature, it will immediately tell you to call 999 if there's a suspicion of another form of deterioration rather than the fall. Equally, we know from falls that, you know, as you grow older and more frail, the bone density decreases, etc. So that indication for trauma gets heightened. So where there's trauma to the neck, the back, or the head, clearly at that point, you know, that's a causation as a red flag that we might want to escalate more appropriately. That unusual sense of behavior. So going back to the soft signs where I talked about that earlier, understanding that resident's norm, sorry, go back. So thank you. Understanding that resident's norm, if there is differences in behavior, so new onset of confusion really quickly after the fall, you know, where we knew there was a head injury, etc., or something, that they become very, very sleepy or very agitated, etc. Again, they're cause for concern that would prompt us to escalate. Clearly, any changes in breathing, you know, is an immediate, because we need to make sure that the resident's fine. Bleeding, equally similar to breathing, actually. You know, if we're seeing bleeding freely from the resident, then again, it would be a red flag, especially if there's, you know, blood pumping from a wound, you know, if they've cut or grazed as a result of that. And then loss of consciousness, you know. So the app will talk you through, but on its first slide within the assessment, will ask for any of those red concerns. So very, very quickly on use of the app, you'll be able to see what next steps are needed to be taken. So it won't, there isn't an expectation to go to lots and lots of questions if there's a suspicion that that resident needs urgent care. Okay. And then obviously evidence of a fracture that we know, for example, the fractured neck of femur. Sometimes it's very obvious to see shortening of the leg or rotation of that leg, and that can be quite visible. And if you're in a nursing home, you'd expect your nursing staff to recognise that quite quickly. But those residential or dementia, etc., because you might have had some of those as residents have been aging, you might have already become familiar yourself. So if there is suspicion of a fracture, any obvious deformity there that we would expect, again, and the app will talk you through all of that. It guides that user through. So whether you're a junior carer or a more senior carer, it will guide you through exactly the same. So it shouldn't matter. And equally, the key to this as well is obviously communication within your own home. So if you're a relatively junior member of staff that has identified a fall, it is in that first instance working with the app and informing your senior within the home. You know, it doesn't take away that policy of good communication within our teams. So if we could have the next slide, please, Naz. And here you'll see the pathway that we've proposed across the region, and ICSs and leads have really signed up and endorsed this. So we've been sharing this with the deterioration safety networks, and lots of those networks are already prompting to, get the iStumble app on all of the iPads in their area for their care homes. And I know there's a few of you on the call today that have already progressed with that, because I know Black Country and West Birmingham, as an example of an ICS, have already committed to rolling this out across the system. And equally, on the actual app, it does give you a bit of an indication. So it gives you those red flag pathways, so you can pick up clearly the pathway there. And it might be advised, what we'll do is send out those pathways, but these are a guide. So like Ash said, there might be subtle changes within your ICS, because it might include numbers for falls teams or physio on there. It might link to your clinical escalation pathways, but having these as a prompt within your care homes is a really good visual guide for certainly junior staff as well. So being aware of the red flags. Next slide, please, Naz. So here you can see again the visuals of the iStumble, and this aligns to that pathway that Dan and Ash have took you through earlier. So where the persons fell, it goes through those red triggers, and you can see where there is a red trigger identified, the app confirms to you at that point to call 999. And that's where that pathway will kick in, where we'd expect that video consultation from a clinician back to you so that we can have that joint assessment. If not, it will give you then that further check of, is there any intense pain? Is there a suspected collapse or consciousness, etc.? So it goes through a more detailed assessment at that point, but it goes through a very, very quick, fast response first initially, just to make sure that if there is a real urgent need, that person's escalated straight away. So if we can have the next slide, please. Excellent. So again, you can see here the FAST test, which I've been talking about, those facial movements, the arm movements, the speech and the time. So it includes the suspicion of stroke there, or more serious deterioration of condition away from fall, or the cause of a fall, because we know some of our residents actually, the cause of the fall is because of a much, much more severe deterioration. So we need to be understanding that, and the app does all of that for you as well. So really quite useful and quite intuitive in terms of its approach. Next slide, please, Naz. So then just to finish around the app, obviously you'll get the guidance about how to download these onto your iPads, and some guidance from your CCGs or local authorities about how to use these moving forwards. But clearly this is very much about escalating a resident with those red outcomes. So where we know that red outcomes are displayed, that's the causation for the 999 call, and the app will support us with that. But it's, communicating that within our teams, within the homes, where possible, using the SBARD, because using the app and the SBARD that links to this, so tools that you've got from other parts of the deterioration pathway are absolutely relevant here. So we're not taking away anything that you're already doing. Making that resident comfortable is a given. Lots of your policies will say not to move the resident until there's been an assessment. Well, the Falls iStumble app helps with that. And then that, if there is any red outcomes, clearly then it's that discussion with the clinician about moving or not. If you're on the left side of that pathway, it's then actually assumed where there's no red flags that you're safe to move that resident, but they might need some aftercare from physio or frailty team, etc., or falls team. So making them comfortable where possible. What we don't want is residents lying on the floor for prolonged periods of time, but understand equally, this is not about you making the clinical decision making. This is supporting you to identify which of your residents from a fall goes on then to need that more severe urgent care response. And then equally importantly is that, and most of you in the Slido said that you're already using your iPads for video consultation, but where you have that video consultation, you obviously need an NHS email. So hopefully all of our care homes now have progressed that. That was something at the start of the pandemic that got launched very, very quickly from NHSX. And we'd hope that you've got that. If you haven't, then your CCG teams or your local authority teams locally can help you with that. But you can get that sorted relatively quickly and easily. And again, we'll send out to you the best way to do that in the resources. So at this point, I'm going to ask Naz to stop sharing. I'm going to invite Ash and Dan to turn their cameras back on. And at this point, we know that that's a bombardment of lots of information in quite a short amount of time on this topic. So just wanted to, see if there's any questions, and I've not been following the chat over the last few minutes. So Caroline, if there is, if you could direct those to us. And if not, if you feel brave enough and confident enough where you're using the app already to turn your camera on and to tell us how that works, that would be really helpful for those other care homes who are not using it yet to hear from a like-for-like care home, I guess. Anyone?
There's nothing to add from me, Dan. I think I would just be keen for colleagues, if anyone starts to use it further down the line and has had some success, if you could just feed back, because what we're really keen to understand is the impact this will have on carers. It's so important that we just don't make decisions for care homes on their behalf. This is obviously there to help and support care homes, but if people find it not helpful, then we would be really keen to hear back. But equally, if you believe it's stopped to fall a 999 call, sorry, we would be equally really pleased to be able to hear some more information about that.
Absolutely. Caroline, is there anything in chat that we have not already answered? I saw that SBARD was in there, but I think it's been answered already. Jodie, anything?
Just a couple of questions.
Yeah.
Practical around iPads. If a home hasn't got an iPad, there's still the opportunities to order them. Does anyone know? We might be asking the wrong people.
I think each of the ICSs will have a list of who's because somebody else asked, how do I know if my care homes have got an iPad? Somebody will have a list in the ICSs. We'll try and what we'll do is any questions that haven't been addressed on the webinar today now, we will we'll pick up from the chat log and we'll find out the answers to those questions and get back to the originator of the question. So we don't know the answers to who holds the list of where the care home iPads have been circulated to, and we don't know the process for ordering, but we'll try and find that out for you and get your ICSs to put some comms out around if new iPads are needed, where they can potentially order them from. I hope that's helpful.
Do you want me to come in with another question from the chat from Anita?
Yeah. Yes, it's free.
Yeah.
About do more falls happen overnight? And just Anita finds that she tends to find them happening in the early hours of the morning, particularly with dementia patients, and just reinforcing really that make sure your night staff are trained as well in the pathway and that awareness.
Really good point. I don't know if the data, Ash, went into that level of detail about falls, but
I haven't got the data as such, but I am doing this as part of my master's, and interestingly not, I think it seems to be more, although it obviously will vary per home, but I think a lot of the falls that I've seen as part of my research seem to be during the day, and a lot of it is trying to get to the bathroom. So it's residents when they feel that they cannot, or that they don't want to burden staff because they want to stand up and try and get on with it themselves. That was one of the biggest things. So a lot of the falls happen in bathrooms and in toilets.
And the 999 data as a whole for care home 999 calls, it's a really predictable curve throughout the day that starts off at sort of 8-9 o'clock in the morning up to a midday peak, and then goes down again. So that's all 999 calls to care homes, of which falls will only be part of it. But over 3 years worth of data, there's the most statistically significant predictor of 999 activity into care homes is time of day, which is really interesting.
But still, night staff should also be trained on it regardless.
Absolutely.
I can see Jeff, you've got your hand up. So Jeff, if I can bring you in, because
thanks, Dan. Yeah, just a couple of questions. I'm interested to know whether all hospitals, clinicians, and paramedics are trained on this yet. You know, where are you in terms of the NHS ready to rock and roll with this in real practical terms?
Jeff, are you the same Jeff that's on my care home board?
Right, so
Ah, lovely to see you. Yes, so where we're up to at the moment is EMAS are already on board. This has been signed off in both the ambulance services. In terms of the hospital settings, the NHS, to be honest with you, we will share it with our primary care network for GPs to be cited on. But if I'm really honest with you, I don't think this should affect A&Es or our hospitals too much, because really, to be honest with you, if somebody needs to be brought in, they will be absolutely brought in. We're not for 1 second suggesting that we do not bring in residents that do not require the right. You know, at the end of the day, it's really important that we don't stop ambulances bringing individuals into hospitals that require it. We're trying to get it to the point where when a 999 emergency ambulance is being dispatched unnecessarily, I think is our biggest issue, because we don't want residents waiting for that. So in terms of the rest of the NHS, ambulance service are fully signed up to this. They're really keen to be able to support care homes with this. And because really, if they go on to the right of the pathway, it probably indicates that there's a genuine reason why they're calling, and therefore I think that will help narrow down some of the questions that they ask as well. So I think if care homes say that we've used the iStumble app and it's told us to call you, it probably indicates that there's a genuine reason for the call, and it probably is quite significant.
Yeah.
okay, I wish I shared your view of how ambulance crews react right now, Asher. There is far too much evidence for me to indicate that they are actually trying to find reasons not to take residents into hospital. But perhaps that's for another time. But it's a really serious issue out there.
Yeah, I think there's a huge amount of pushback at the moment to not bring people into hospital unless there's a desperate need for it. And the reason why that is simply because we're taking them from a protected environment where we've got doubly vaccinated staff, or a now booster, where we can protect them in that environment. But the minute we bring them into a hospital setting, we've got individuals across A&E that are unvaccinated, that not only have COVID, but may also have flu, may also have norovirus, etc. So the minute we put them into that ambulance and we bundle them up and bring them into A&E, we're actually exposing those care home residents to all sorts. Hence the reason why there's a complete reluctance to bring them into hospital unless it's absolutely necessary.
Thank you.
Molly in the chat has given some information about how to access iPads as well, which
Brilliant. Thanks, Molly.
thanks, Molly. So I'm going to bring this part of the session to a close. And thank Ash and Dan so much for your support on this.